patients enrolled for home-based palliative care. Now the data is extracted from the demographics and the diagnosis symptom burden, which is done by the Edmonton Symptom Burden Scale. Along with that, the palliative interventions, need for hospital and hospice transfer, and time from referral to death, caregiver satisfaction score. Now the analysis is done in descriptive analysis method. Now coming to the patient demographics, how the patient, which patients we take in the study. Now over 160 patients consisting mainly of gastrointestinal and head and neck cancer of 22% each. Along with that, lung cancer of 18%, breast cancer of 16%, ovarian cancer of 7%, and the rest of the cancer of 15%. In there, the median age varying from 59 years, and the male population constitutes of 56%, and the female of 44%. Symptom burden and the reason for referral. Symptom burden is assessed by the Edmonton Symptom Burden Score, which refers to the present condition of the nausea, vomiting, how the patient is presently in the state of tiredness, or the patient has got any other cervicointestinal obstructions or any abdominal emptiness of that, and along with the terminal delirium, breathing difficulties, constipations, nutritional management, care of bedridden patients, along with very few lymphedema management also. Now survival and the care periods. The mean survival from referral to death is 17.9 days plus minus standard deviation of 2.4 days, which is done by a mean, median and mode scale and of all the 160 patients. Now the care model suggests of 82% received exclusively home-based palliative care till death, 18% required no hospice or the hospital transfer due to some reasons which are stated here. Some of them need for the BiPAP support, 10% needed BiPAP support in view of COPD or in view of any other breathing difficulties or heart failure. For the lack of the IV morphine availability in the community level is also one of the main trouble of that. Because of the, and also the patient and the relatives have very less knowledge of the morphine availability in our commercial structures in the locality. Then now to the need for the USG guided pleural tapping, which constitutes 25% in view of shortness of breath and other acute breathlessness. Number 7, CGHS and other government health schemes which are easily available to the patient.